So a dental implant is the replacement for a root of a tooth. It's classically made of type 4 titanium, which is a medical grade titanium, cylindrical and roughly root shaped, and they are inserted into the bone where a tooth would have been at one time. So once an implant is integrated in the bone, and by that we mean the bone has fused to the implant and become part of the patient, we can then remove the healing cap and place a single tooth, bridgework or overdentures if we're going to stabilise somebody's perhaps loose old dentures that they can't cope with. So when we lose a tooth, we judge that space and the result on the patient in 5 ways. There are phonetics and how it makes the patient speak. Front teeth particularly can affect the way a patient talks. There's a psychological element. Some patients are particularly disturbed by the fact that they've lost a tooth. There's function. That's classically back teeth, and when people lose back teeth, they lose the ability to chew. There's stability, and that is the way in which the teeth that are now unopposed or either side of a space can move as a result of there being a missing tooth. And then there is one other one which I've forgotten. And of course I forgot the most important one for some, which is cosmetics and how the patient feels when they've got a full set of teeth and they can smile. So the advantage of an implant over, say, a fixed bridge is that to perform a bridge we have to shave the teeth down either side of the missing tooth, and that puts them on the restorative treadmill that they can't get off. The teeth have been prepared and they can never have that tooth put back, whereas an implant stands in its own right and each tooth either side can each survive and exist in its own right too. So the advantage of implants over, say, dentures is that a denture classically is removable, and because it's removable it will move, and so having fixed teeth which are more lifelike and more tooth-like is generally preferable to the patients. So when we talk about all on 4 or immediate full arch loading or teeth in a day, that's classically where teeth that are maybe at the end of their life, they've reached the cliff and they're about to fall off it. It's called the terminal dentition, when teeth really can't be saved, they've had as much treatment as they possibly can and we need to move on to something else. Classically, that something else would have been dentures, and particularly full dentures, which come with an array of problems. Teeth that are fixed in the mouth, in comparison to dentures, give patients an experience that's more similar to them having their healthy natural dentition. My colleague Paul Davis has a particular interest in the restoration of full arches, that's whole mouths, and full dentitions, particularly with an approach that involves teeth out in one day and implants and new teeth placed on the same day. And you'll be excited to hear his take on immediate full arch loading.